Let's compare Medicare for seniors under the Affordable Care Act and Medicare for seniors under the Ryan Republican plan that passed as part of the Republican budget. Under the Affordable Care Act, the donut hole is closed over 10 years. The actual, not magical check, Mr. Holzkamp, of $250 that seniors received last year paid for actual groceries, paid for, excuse me, Mulvaney, you're sitting behind Mr. Holzkamp's nameplate, forgive me. The actual $250 check, not magical, pays for actual groceries, pays actual mortgage, is actual money. So to suggest that somehow the $250 check is mythical or magical or non-existent is completely false. I've stood in front of numerous town hall meetings in my constituents, asked for a show of hands of how many seniors got a $250 check last year, and plenty of actual hands go up. The 50% cut in name brand drugs, the gentleman wonders how it's paid for. I'll remind the gentleman that the entire Part D prescription drug plan was never paid for by the Republicans and added $400 billion to the deficit over 10 years and $7 trillion to the deficit over 75 years. So when it comes to who made sure that we reduced costs in Medicare, who made sure that when we passed new policy that we ensured that it was paid for, Democrats did so and preserved and protected and extended the life of Medicare, and Republicans jeopardized it. In addition, the Affordable Care Act adds preventative screenings, like mammograms and colonoscopies, that used to have a copay before the Affordable Care Act passed and that now are free, which means that we shift the focus in Medicare from a sick care system to a wellness and prevention system. And we ensure that seniors can stay healthy, and we save health care costs down the road, because if they get screenings up front, then they are less likely to get sick down the road. A wellness checkup, which was not something seniors were entitled to before the Affordable Care Act, a free annual wellness checkup. Now they are entitled to that, again, being able to preserve their health rather than having them access the health care system for the first time once they're already sick, which we know would increase costs. And then so let's look at the Republican plan, the Ryan Republican plan to end Medicare as we know it. Gives a voucher to seniors and leaves them to the whims of the private insurance companies to get health insurance on their own, and adds $6,000, actually more than $6,000, to the bill of Medicare beneficiaries of seniors, all in the name of making sure that we can preserve tax breaks for millionaires and billionaires. So, Dr. Feder, if I can ask you, as you know, we've had some discussion this morning about the IPAB and what it can and can't do. It's explicitly forbidden from recommending any changes in premiums, any changes in benefits or eligibility or taxes or other changes that would result in rationing. So through those prohibitions, the IPAB can't increase Medicare beneficiary premiums or cost sharing at all. They can't decide to just tell a doctor that a knee surgery is $1, and that's the end of the story. So accuracy is important. Do you agree with the assessment that seniors could face higher out-of-pocket costs as a result of the Republican Medicare plan? And could you respond to my comparison of the two approaches to how we preserve Medicare and make sure we bring down costs and protect seniors?
Thank you, Ms. Wasserman Schultz. I do agree with your assessment, and let me give my interpretation of how that occurs. As I indicated, the voucher that is in the Republican budget is taking all the reductions in payment growth that we've talked about into account. That's all been accepted by Republicans in the House. And gives a budget, then gives a dollar amount for seniors to purchase private insurance, which the Congressional Budget Office says is already more expensive than the Medicare plan for seniors, and will be much more expensive in 2022 when the voucher is expected to start. What that means is we are sending seniors on their own. We'll be sending seniors, myself included, on our own to shop for benefits without the ability of having the government behind us to negotiate or set prices on our behalf, determine that the benefits are what they ought to be. So it is simply a cost shift that, according to the Congressional Budget Office, actually increases costs to seniors.
And would you say that it sounds to me that there's no debate over those facts, and those facts are inevitable.
I have not seen any. I
We'll
think
have to
that
leave it
that's
at that.
definitive.
Thank you.
Thank you,
Good
Mr.
place to leave
McClintock.
it, Mr. Chairman.
Yep, Mr. McClintock.